Welcome, everyone, and happy Pride. My name is Kendall Gender, and I want to thank you all for tuning into this exciting event called Pride, Sex in this Pandemic, organized by Community-Based Research Center and YouthCO here in Vancouver, with the generous support of ViiV Healthcare. I thought it was only appropriate to stream directly from my bedroom. I'll let you in on a little secret. I have sex here too. Safely, of course. Before starting, we want to acknowledge that the CBRC and YouthCO's work, as well as all of our presenters, spans across the unceded, ancestral, and traditional territories of the Musqueam, Squamish, Solo, and Tsleil-Waututh First Nations. We are grateful to live and work on these lands, which have been cared for by Indigenous people since time immemorial. As we come together to celebrate Pride, we want to acknowledge that many of our views today on gender and sexuality have been impacted and shaped by colonization. We still have much work to continue to do when it comes to decolonizing, remembering and relearning Indigenous teachings, which have celebrated many gender and identities way long before colonization. Today, you will hear updates from local sexperts about different aspects of queer and trans men's sexual health in BC, from the Provincial PrEP Program to the impacts of the pandemic on queer guys. There's lots in store, and there's lots of me as well. Hold for applause. If you have any questions for our panelists at any point during the event, just write them in the chat and I will ask them during our Q&A session at the end of the panel. Now, to kick off this discussion with a bit of context, I have the pleasure of introducing our first panelist, Darren Ho. Darren Ho is the BC Regional Manager at CBRC. His role is to ensure that resources for GBT2Q guys are equitable across all of British Columbia. His focus is on knowledge and translation and capacity building in ways that allow queer guys to self-advocate for their health within their own communities. So Darren, I hope you too are wearing a red bandage dress and diamond earrings, and we're gonna talk about it. What stage for us? Who is CBRC? What work do you folks do? And what are some key takeaways from the PrEP situation here in BC?
Thank you so much. Hi, everyone. Thanks for the intro, Kendall. So yes, I'm Darren Ho from CBRC, and I'm wishing everyone a happy Pride season, even if our celebrations look a little bit different this year. In my presentation, I want to talk a bit about how the COVID-19 pandemic has impacted our communities and a bit about the uptake of pre-exposure prophylaxis, aka PrEP. But first, for those who don't know Community-Based Research Center, we started in 1999 as a response to the HIV crisis amongst gay men in BC. While we were founded by and for gay men, we have made strides to include other sexual minority men, including bisexual, queer, cis and trans, and two-spirit people. CBRC is dedicated to using community-based research to develop knowledge about the health of gay, bisexual, and other men who have sex with men, and to develop interventions addressing our health and social issues. Our core pillars are community-led research, knowledge exchange, network building, and leadership development. And these pillars really position our organization as a thought leader to advocate for the health needs of our communities. And because it's Pride, I want to highlight some of the progress that we've seen in Canada since last Pride. When it comes to visibility and awareness, last October, we saw the London and Barrie, Ontario City Halls raise the intersex flag for the first time in honor of Intersex Awareness Day. We also saw on our television screens, two-spirit couple Anthony Johnson and Dr. James McCocus become the winners of Amazing Race Canada Season 7, making two-spirit something of a household conversation topic around dinner tables all across the nation. And in March this year, our federal government introduced legislation to criminalize efforts to change sexual orientation and gender identity, a practice commonly referred to as conversion therapy. As we know, there's been a lot of progress for us queer people here in Canada over the past many years, from gay marriage to the federal apology from our Prime Minister. And these are just some of the examples of the progress we've seen so far. But also, as a lot of us know, this progress has not impacted us all in the same way. And by that, I mean, if we are living in fear or under threat of police violence, or if we are homeless, for example, then the fact that we can get married is unimportant. And that's what CBRC has been working on, to make it known that despite gains in political and human rights and visibility, the health outcomes of all queer people continue to be some of the worst in Canada. I want to talk about some of the impacts of COVID-19 and the impact on queer communities, but I want to start with recognizing that it's provincial governments that are largely responsible for our health care, which means that there has been some different responses to HIV and trans health, as well as different responses to COVID-19 and distancing restrictions for each province. But the underlying note here is that where we live impacts our health access, whether we live in urban, suburban, rural, or remote communities. Right now, we've got a pandemic on top of multiple epidemics and health crises, or what we call syndemics. And of course, it's feeding into some of the issues that we are facing as a community. We recognize that the urgency of COVID-19 has required a massive reallocation of healthcare resources, and in no doubt, these efforts have saved lives. But as we adjust to a new balance, we continue to advocate to health leaders and policymakers to prioritize and fund mental and sexual health services for all communities, as well as services for substance use and addiction and trans health. In our Sex Now survey, we collected data from over 6,000 gay, bi, trans men and two-spirit people in Canada. More than half the participants said that they needed help in areas like anxiety, depression, and loneliness. And among this group, 1 in 5 reported needing help with suicidal thoughts. Social and physical distancing is likely to further impact our mental health. And as we limit access to social support, such as friends or partners, free or low-cost counseling and support groups run by community organizations become even more important resources that we can be offering now. We also know this pandemic is impacting trans health, as many transition-related healthcare procedures are considered non-essential and therefore postponed. For people wanting gender-affirming surgeries, hormone therapy, it is essential and can significantly reduce distress and increase mental health among trans and non-binary people. Fulfillment of transition goals is linked with a 62% drop in suicide ideation, according to a Trans Pulse study in Ontario. When it comes to sexual health, we know that the pandemic required some healthcare workers to be reallocated away from areas like STI and HIV testing. And this has a direct impact on queer men who still account for the majority of new HIV infections in Canada and are overrepresented among new cases of STIs, including syphilis and gonorrhea. Maintaining effective access to testing and treatment is crucial as people's routines are being disrupted. We're worried about a surge in new infections post-pandemic, rolling back the progress we've been making with PrEP and treatment as prevention, U=U. And despite physical distancing guidelines, we know that sex still does happen even in a pandemic. We're concerned about the shame associated with casual partners and how that might drive testing and sexual health seeking behavior underground. If we're not supposed to be hooking up, but we do, then where do we turn to for our STI-BBI prevention needs? And so on the topic of sexual health, I want to bring our attention now to PrEP, which is our big topic of discussion today. I want to first acknowledge that while PrEP is becoming more and more known as an HIV prevention tool, we as a community did not do our best when it came to making this tool known and accessed in Indigenous communities. And by that, I'm referring to how PrEP had actually been available free of cost to First Nations and Inuit people since 2013, which was years before our provincial PrEP programs launched. All First Nations people living in BC receiving benefits through First Nations Health Authority could access free PrEP, and Inuit people receiving benefits, Inuit people in BC and nationwide could access free PrEP through their non-insured health benefits. And we knew that PrEP was an effective HIV prevention drug as early as 2012. And in the 5 years between 2013 and 2018, only 13 First Nations people in BC were accessing this free drug. Contrastingly, once PrEP became available to the general population in BC, over 3,000 people were being prescribed PrEP in that 1 year. So somewhere along the way, health promotion messaging on this very important prevention tool got lost for a very large community in Canada. Community organizations like the one I'm a part of, CBRC, have a lot of work ahead to make up for this. On my slide, we see stats from our 2018 Sex Now survey, which shows that 76% of Indigenous guys and Two-Spirit people reported that they know about PrEP as a prevention tool. However, when we ask guys whether or not they've ever used PrEP, we see that only about 8% said yes, currently or previously, and 88% said no, they've never used PrEP, which again calls into question perhaps the efficacy of the type of messaging communities are getting on PrEP and how accessible it is for Two-Spirit and Indigenous folks. Here are the preliminary findings of the PrEP study, a study led by Dr. Darrell Tan, and is a multi-center Canadian implementation science effort to link GbMSM in Victoria and Toronto to PrEP according to the cascade of steps. The PrEP cascade has 7 columns. The first is identifying MSM at high risk of HIV acquisition. For example, guys who have tested positive for syphilis or other rectobacterial STIs, guys with a HERE score of 25 or higher, guys with a recurrent post-exposure prophylaxis prescription, for example. And next is the recommendation of PrEP services, then the acceptance of PrEP services, and then referral to a PrEP service. So in this study, we see that of the 1,388 guys identified as high risk, 68% were recommended PrEP. That's the orange bar. The ones who were not recommended PrEP were those who are HIV positive or already on PrEP. And then we see that a 52% of those who were recommended PrEP accepted PrEP. And so the drop here came from folks who declined because they didn't feel they were at risk or they were concerned about the side effects. Additionally, folks also may have declined for a host of other individual reasons, such as being a visitor to or emigrating from Canada, entering into a monogamous relationship, having a preference for condoms, or an inability to attend PrEP appointments, for example. However, of the group that accepted PrEP as an option for them, almost all of them, so 99%, went on to be referred PrEP. And so currently, this study has not yet released the stats of the other 3 columns of the PrEP cascade, which are attendance at the PrEP service, uptake of initial PrEP prescription, and finally, retention on PrEP for at least 6 months. And so this is just a glimpse of what we're seeing with PrEP referrals and uptake so far. And I'm going to let Dr. Hall and Adrian touch more on this in their presentations. Lastly, when it comes to the intersection of PrEP and this pandemic, what we're hearing anecdotally is that guys may be taking a break from PrEP as COVID-19 social distancing guidelines has restricted the types of sex some guys otherwise would be having. You can read on my slides some of the quotes from PrEP users and what they've said about taking a break from PrEP. So we know that guys are thinking about how our sex lives may be changing or impacted by COVID-19, and we're adapting our prevention efforts accordingly. And so something I'm thinking about is perhaps what kinds of messaging or education we could be bringing forward in terms of taking a break from PrEP or messaging or promotion around the PrEP on demand approach, which might be useful for those of us who want to continue using PrEP, but not on a daily basis. Finally, I just want to plug CBRC's upcoming COVID-19 edition of our Sex Now survey, so you can let us know how this pandemic has been affecting your sex life and health in general. And we'll be launching this survey very soon, so stay tuned for that. And with that, that's all I have. So thank you for listening and hope everyone stays safe.
Yay! Thank you so much, Darren. Give me some claps in the chat for Darren Ho, everybody. Woo! I'll be touching base with you later to see you in that red bandage dress, I'm hoping. Speaking of PrEP, our next guest speaker is someone with a lot of knowledge on the subject. Dr. Mark Hull is a research scientist at the AIDS Research Center at the Program for BC Center in Excellence for HIV and AIDS, and is a clinical assistance professor in the AIDS division in the Department of Medicine at the University of British Columbia. He's also a staff physician at St. Paul's Hospital and a physician at various clinics across the Vancouver Coastal Health. He is truly, truly, truly doing the work for us right now. And I just want to say from all of us, from the bottom of my heart, we appreciate all that you do every single day, especially in this insanely wacky time that we're in. So thank you so much for being with us today, Dr. Hull. tell us, what is the PrEP program looking like in BC?
Well, thank you very much for inviting me to take part in this. And what I'm going to try and do is share some slides as well. So hopefully technologically this all goes well. And you should hopefully start to be able to see my slides. And I'm going to carry on from where Darren left off. And what I thought we would do is just run through what we know about where we're at the moment in terms of HIV in the province, and give people a bit of information about the PrEP program. And then I'm really looking forward to the discussion and question and answer period. So let's start. We're just going to touch basically on what we know with where the HIV epidemic is in BC at the moment. My focus really as part of this talk is looking at gay, bisexual, and other men of sex with men, which I'm going to abbreviate through my talk as MSM. So if people get confused, MSM is what I'm going to use as my catchphrase. And then just go through the PrEP program and give you what we have for the first 2 years of data. So here's the most recent slide that we have from the BC CDC, looking at our HIV new diagnosis rates in BC in purple and comparing it to the Canadian average rate, which is in orange. And you can see definitely if we go back to the early 1990s where the HIV epidemic was at its peak, we've made tremendous strides in reducing our new infections. And you can see in the last few years, our new diagnosis numbers in British Columbia have dropped below the Canadian average, which is something that we're very proud about and reflects a lot of the great work by Dr. Montana and other people in leading the fight to get antiretroviral therapy widely available around the province. We know if we look at HIV itself, that this still is predominantly something that affects young gay men. And you can see here, again, the data is from 2017, but probably is going to be very similar to the last year or two, that most diagnoses occur in people who are in the age groups 20 to 30, and then 30 to 40 years of age. So really affecting young gay men. We know if we compare to injection drug use, which is our other main route of infection in the province, for the last 3 or 4 years, very, very clearly, the majority of infections that we have in the province are occurring in MSM. So this peaked in 2017, just prior to the PrEP program, and really was, I think, some of the main rationale for why we targeted our program towards gay men is the fact that diagnoses were occurring in about, our new diagnoses, 6% of them were made up amongst MSM. And in 2017, it was almost 70%. So definitely we're bearing the brunt of the diagnoses in the province. I think you've all heard about our goals for people accessing antiretroviral therapy, which is to make sure that 90% of people living with HIV are aware of their diagnosis, are offered treatment, and achieve virologic suppression. And the reason for that, I think, again, as you all know, is really we have very, very clear data for treatment as prevention and U equals U. So I think this really is one of the major goals of our treatment program, is keep people healthy for themselves, but obviously it also makes them very comfortable with their partners because there's no risk of transmission. If we look at PrEP now, we have very, very strong data from the United States, and this is just one example from San Francisco that tells us that people who use their PrEP on a regular and prescribed fashion really have very limited risk for HIV infection. It's got a very high degree of protective benefit. So in San Francisco, in their first few years of their program, they had almost 700 people on PrEP, and they saw nobody taking their PrEP properly experience an HIV infection. But unfortunately there, due to insurance reasons, 2 people stopped the program and ended up becoming infected. So it really gives us real world data to know that PrEP is highly effective. We in British Columbia, and really this drove a lot of the Canadian guidelines as well, have focused on trying to identify who, from a program point of view, we can get clinicians or people themselves to identify as perhaps being at a slightly higher chance of catching HIV or becoming infected with HIV. And we have Dr. Nathan Lachowski, who I think many of you know, to thank for some excellent work through the Momentum study. Maybe perhaps some people here are taking part in that study in the city. And here, this is where we validated in Vancouver some of the indicator conditions that we use for PrEP at the moment. So we used a risk index score, looking at the type of sex people have or the number of partners that they have, called the HERI-MSM. We found that in people whose score was over 10, the risk doubled from 1% to 2% of becoming HIV infected. And if you, and I think Darren alluded to this earlier, had a score over 25, then you were in our highest risk group. In other words, you had a 7% higher chance of catching HIV compared to the average guy in Vancouver. And the other thing that made part of our guidelines and our recommendations for PrEP are previous STI diagnoses. So syphilis or rectal gonorrhea or chlamydia, very highly indicative of a future seroconversion event if we look at risk factors for people that might have a higher risk for HIV. We know, unfortunately, that people don't do a good job of estimating their own risk for HIV. So this is, again, data from Momentum. And we can see, if we look just at the bottom row here, we know in Momentum, the risk was 7 times higher than the average guy, but 2/3 of those people still consider themselves a very low risk for infection. And I think this is one of the reasons why Dr. Darrell Tan and I have worked on the PrEP cascade, is we really want people, when they come into a clinic, to have a conversation about sexual health and include a conversation about PrEP as part of a sexual health conversation. And so looking at this cascade starts to tell us a little bit how well systems are adjusting to integrating PrEP into their regular offer of services. For the BC program, we launched this study, or this program, I should say, in 2018, funded by the province. So any BC resident is freely able to access PrEP without any cost implications. And this uses the criteria that we've just gone through. So it's recommended for people with a high HERE score, people with a prior STI diagnosis, or if you don't really fit into those categories and you feel you may be at risk for infection or considered PrEP as one of your sexual health strategies, your healthcare provider could check a box to say that this is recommended based on their discussion with you. So you don't have to fall into the criteria that we just went through, although we definitely recommend it to people who met those criteria. But there is an opportunity for anybody really under support from their healthcare provider to move on to PrEP. To get onto PrEP, of course, we need some baseline blood work to make sure it's safe to do so. So we want to make sure that you're HIV negative and that your kidneys are functioning well, because the PrEP can affect people's kidneys fairly rarely. And we also have to check hepatitis because there's some cross-reactivity of the medications. Here's the data for our first 2 years of the program, and you can see we've been very, very happy with this. It looks excellent. We have had very steady uptake month after month after month for the first 2 years. And basically at the end of 2019, so 2 years into the program, we had just shy of 6,000 people who had ever accessed PrEP. And you can see in green at the beginning few months, a lot of people had been on PrEP through private insurance, and they transitioned into the provincial program. We know if we look at people that most people meet the age groups that we're aiming for, so very young individuals. The majority of people starting on PrEP meet the age group where we're seeing the most HIV infections. So that, again, is very, very encouraging for us to see. And if people are interested, we can see that most people met the criteria based on an elevated HERE score or having had prior infections. So it tells us a lot of the clinics are integrating this into their assessment and are offering it as part of the cascade to people that would benefit from PrEP. If people want to know where people are accessing PrEP, most people are doing it in Vancouver. 24% sort of fall into the Lower Mainland as a whole. And then the rest of the province, so Vancouver Island, Northern BC, BC Interior, make up about 17% of PrEP starts over the last 2 years. For our cascade, Darren's cascade stopped when people were recommended PrEP. And here I'll show you BC data for those last 3 parts of the column. And we can see that most people have stuck with the program fairly successfully. So here's the people recommended PrEP. We had a very tiny drop-off for people who didn't end up starting on PrEP. And then finally, we have about 20% of people or so who ended up over 2 years stopping PrEP, either because they were in a relationship and weren't at risk for HIV, or they didn't want it anymore, or a number of other reasons. So very successful uptake so far for the first 2 years. Who is prescribing PrEP? Most people are getting it from sexual health clinics. So the HIM clinic, the Bute Street Clinic, some of the sexual health clinics in Victoria, they're responsible probably for the lion's share of prescriptions. And clinics like Spectrum Health or Kool-Aid make up another big chunk of people. And then 92% of providers are just family doctors, and they usually have 1 or 2 people that are on PrEP. But our sexual health clinics really have taken the ball and run with it, which is all we could have hoped for in terms of a PrEP cascade so far. We've seen some data from PrEP already, and I'll just share one slide before we wrap up this part of the presentation. But I think we still have a ways to go in terms of getting people onto PrEP. We had a community knowledge survey in Vancouver and Toronto, asking guys coming into our sexual health clinics at Butte and HIM, hassle-free in Toronto, have you been on PrEP? Are you using PrEP at the moment? And you can see there's a huge difference between BC and Ontario, driven by cost because our program here is free, so we're doing better than Ontario for sure. But still, a very significant proportion of people in BC accessing a sexual health program had never been on PrEP before. So I think there's still room to go for our messaging to all communities and populations about PrEP as a potential option for sexual health and HIV prevention if people are interested in it. So I'm going to stop there. Up until 2020, our data suggests that our HIV diagnosis rates have stabilized. We've had perhaps a few new diagnoses this year in the first few months of the year, and we'll have to tease out what effect COVID has had so far with that. I definitely support any messaging to improve access to PrEP knowledge and PrEP services around the province. And I think in the future years, we're really going to have to try and figure out where is our HIV epidemic moving and make sure our PrEP services and other HIV prevention services are targeted to people that would benefit the most. So I'll stop there, and I know that was pretty quick, but I'm happy to answer any questions as the webinar goes on. Thank you.
No, thank you so much, Dr. Hall. Thank you for sharing all those insights with us. I don't know about you, but it's information like that I just feel so thankful to be living in BC myself. So give it up for BC Healthcare. Woohoo! As a little reminder to all of our audience members, if you have any questions for any of our panelists, drop them in the chat and we'll ask them during our Q&A period at the end. Our last guest speaker will be talking to us about community harm reduction and empowerment. Adrian Bustamante, I just like saying that last name, Bustamante, is a first-generation Canadian from Chile and the program coordinator for Empowerment YVR at YouthCO. As a queer person of color, they strive to better the queer and trans community within the Musqueam, Squamish, and Tsleil-Waututh territories through community building, programming, and empowering fellow youth on their journeys. Welcome, Adrian.
Hi. Thanks, Kendall. It's a pleasure to be here. Oh, thank you. I thought it'd be a little bit more Friday today for y'all.
So, Adrian, what kind of stories have you heard at your job, and what can you tell us about them?
Well, they vary. I just want to first and foremost say thank you for my fellow panelists, Dr. Hall and Darren Ho, as well as Kendall Gender for being such a great host today. It's been amazing to hear and just be your presence and your awesomeness. So yeah, basically today we're going to talk about a little bit about what empowerment is as a program, along with what we're doing, and then also kind of what it looks like to access PrEP in this day and age through live and kind of lived experiences of our community members. So basically, just to kind of start us off there, maybe I'll just try to share the screen here. Technology, yay.
Yay, we love it.
There we go. So just a little bit about who we are. A little Empowerment 101 is right here. Oh, no. Technology. Oh dear, there we go. So yeah, just a little bit about Empowerment 101. Empowerment is a peer-led space for queer and trans youth, ages 15 to 29 years old, to meet, have fun, and support each other in making informed decisions about our sexual health. These are a little bit of like the pictures I thought it would be nice to share of like our workshops that we've done and socials and our online programming right now as well. So we accomplished this, like I said, through discussion nights, one-on-ones, as well as meetups and workshops, including our latest one that we had last night, which was the Storytellers, A Night of Queer History, which was really, really great and special. We got to hear of some elders from our community, and they shared their lived experiences through the HIV epidemic in the 80s and 90s in Vancouver. So that was really special. We also offer low barrier testing nights where we invite a registered nurse to come in and test like the youth one-on-one privately. So yeah, we at Empowerment basically offer and listen, and I'll probably just do a face thing here. There we go, perfect, that's better. Yeah, we at Empowerment are inspired by Indigenous voices and values, and we apply those perspectives to our programming. We believe that harm reduction practices are are offered for us for those of us that use sex or use drugs is not solely the responsibility of the individual's choices, but it's a lot of systematic factors surrounding that individual situation. So inspired by the words of Two-Spirit Métis elder Marjorie Bocage, Indigenous people don't think of themselves as a body or one thing. We need to treat the whole person, not just one behavior. Yeah, so I think that's really, it's in contrast, I would say, from the mainstream harm reduction, which tends to focus on the small picture of us, those of us that use drugs or have sex and that experience, and kind of gloss over the other factors, including our family, friends, community, and other relationships. When in reality, all these elements, family, community, lands, our spirits, are all connected to our health and well-being. So that's why at Empowerment, we embrace all these elements in our conversations about PrEP as a form of harm reduction. Leading up to this panel, I was really fortunate enough to reach out to some members from our community of Empowerment, including past core group members, some of our volunteers, attendees, and basically got to be there to share their experiences and obstacles on how to get on PrEP in this day and age. All these testimonials are real, and each kind of offer a different insight into the challenges that can arrive trying to access PrEP during a pandemic. The first testimonial that we received was that of a queer youth that was forced to move back in with their family. They were previously on PrEP, but basically couldn't remain on PrEP without coming out to their religious family for fear of being outed or facing backlash or worse. So that was really unfortunate, and basically this is real for a lot of youth living in the Lower Mainland and all over BC during this time of COVID, who have been forced to move back in with their parents due to financial strains or other reasons. And that can be a big strain on their mental health, which is a huge factor for youth having to, basically filter their whole lives to their family in order to keep a status quo, which can be very draining and can lead to a feeling of isolation. Yes, which I can, definitely see that can hinder our ability to access PrEP or even just advocate for our health in general. Another testimonial given that sheds some light on why it's so hard to access PrEP in this time was an individual that lived far from queer and trans inclusive clinics. And they were kind of afraid that their family doctor wouldn't honor their privacy and that they would tell their parents that they're looking into being on PrEP. They told us that they were able to see a doctor to get a prescription, but they weren't able to necessarily fill that prescription at a pharmacy due to their work, and along with the fact that most pharmacies and businesses during this time have limited business hours. So all these factors together, it basically just made them feel like it was impossible to access PrEP, and they really kind of needed that support to navigate that. So I think those are really important aspects to consider in this time and age. In my most recent one-on-one work with someone accessing PrEP, the issue was that they just arrived from another country and that they didn't really know how to navigate our heteronormative kind of cis-based, mostly English-based healthcare system as someone who didn't speak English as their first language, which I think is a really big problem for a lot of people arriving from Vancouver all around the world seeking asylum or other reasons. So on top of that, they didn't have MSP, which is the medical service plan coverage. So basically they figured that the price for PrEP would be kind of out of their range, and they just assumed that right off the bat. So it was very beneficial to kind of give them that extra information and guide them through that process as well. So there's definitely like an accessibility issue when it comes to ESL folks trying to access PrEP. We need to recognize that, and hopefully we can offer some more translations for ESL newcomers in the future. Yeah. To summarize, in these uncertain times, I think it's more important than ever for us to have these conversations together. If you feel like you want to be a part of these conversations as we advocate for our health, Empowerment is always open. And we'd love to hear your voice in this ongoing conversation, and we're here to support you in your journey. So just please reach out. We also offer harm reduction resources. So I will put this extra screen here. There we go. There we go. We also offer harm reductions, like I said, in the form of including condoms, reading materials, safer smoking, and safer injection kits. So make sure to follow us on our socials as well, Facebook at EmpowermentYVR and Instagram at EmpowermentBC, and basically that. And yeah, with that, I just want to leave you with these words that we are stronger and better together. So thank you so much for your time, and happy Pride season.
Yay! Happy Pride season! Thank you so much, Adrian, and thank you again to Darren and Dr. Ho. All three of your presentations were so informative. I was like here writing notes the whole time.
That's good to hear.
I'm educating myself. I love it. Now, dear audience members, it's your chance to get in some questions and some answers. If you have a question that you'd like to ask our panelists, share it in the chat below, and we'll ask it for you. To kick off our Q&A, I have a question for Adrian.
Yes.
Yes.
Hi.
My friends shame me when I tell them that I started hooking up with someone during the pandemic. How do I deal? Am I wrong? How do I go about communicating during a hookup if they seem to have a slight cough, though they told me that they didn't have COVID?
Yeah, I think that's a very real situation. Thank you for that question, Kendall. I would say that it's all about just communication in every moment of any type of like sexual kind of interaction there. Just to voice your concerns and worries. You can always slow things down. You don't necessarily have to completely stop, but that is totally within your realm, as well as consent is something that can be reversed at any moment. So if you don't feel comfortable, I would say that that's the biggest thing to be concerned about. It's just your well-being, and just communicate that in a respectful manner. Yeah.
I love it. Consent is sexy, everybody.
Absolutely.
Over every social media platform, consent is sexy. Alrighty, next up, we have a question for Mark.
Hi.
Hi. So, with 6,000 guys in BC on PrEP, why have we not seen a larger decrease in new HIV infections?
Yeah, I think that's the million-dollar question, really, that we have to start to look at. And I think part of it is really, I think, in the next few months, trying to get some better data from Vancouver Coastal and BC CDC, who've really been focusing a lot on COVID, to say who are the people still becoming infected in 2020. You know, we're 2 years into our PrEP program. You know, who are you missing? I see a lot of people that are newly infected, and I would say a fair number of people are either coming here from other provinces, not yet in tune with the healthcare system here and become infected. We've definitely seen more infections early this year in terms of injection drug use, and I think that's a lot of people getting disenfranchised and disconnected because of COVID. But we don't have all the data for this year. I think we also have to focus a bit on crystal meth, because I feel like that's driving some of the infections that we're seeing a bit. And people there also are really not engaged in knowing about PrEP or knowing about sexual health services in general. So I think it's going to be one of these moving target things, which is every year we're going to have to look at the numbers, see if it gives us a bit of a clue as to, you know, who's becoming infected. And then I think we need to look at the messaging and look at our partnerships with our community organizations and say, are these people actually hearing the message? Are we getting it into the, you know, into the right hands? And how do we improve doing that?
Totally. How do we scream it from the rooftops?
Yes. How do we scream it from the rooftops? If I could, I would.
Me too. Me too. Okay. Thank you so much, Mark. Next up, we have a question for Darren.
Hello.
Hi, Darren.
First, before the question, I'm gonna apologize that I'm not wearing a red bandage dress. Sorry, I couldn't find one in time.
You know what? I will lend you one. I will socially distance, come and meet you, and hand you one so that I can see you in it, honey.
Okay. Thank you.
Okay. So your question: how can we make sure that PrEP is accessible to folks in Indigenous communities? Tell us about your Two-Spirit program manager.
Yeah, so I mean, I think with all types of messaging for queer communities, there needs to be community-specific and community-focused messaging, and that's definitely true for Indigenous and Two-Spirit communities as well. Messaging that is by and for the community, that is by and for Indigenous and Two-Spirit guys. And so with our new Indigenous and Two-Spirit manager, his name is Jesse Dame, he's going to be working on some resources that are specifically for Indigenous and Two-Spirit guys to learn more about PrEP, and so that folks can decide whether or not PrEP is right for them with all of the information that's available.
That's amazing. That's that's so beautiful to hear. I love that. Okay, well, we have one last question. This question is for everyone. So, are we going to put everyone in the screen? Ooh. Oh, yes. Oh, yes. All our Okay. How do we get PrEP and other prevention tools to the people who really need it?
Sorry, I didn't hear who Kendall pointed, but I guess I'll start. I think the more options we have for PrEP, the better, and the more options for like prevention tools in general, the better. We know that home testing is something that's coming very soon to folks in BC. Injectable HIV medication is also something that's coming very soon. I think with the addition of all of these options, we increase how accessible STI prevention can be for everyone. So I think, so more options and more education and more awareness for all of these things.
I would add to that, and I think what you said earlier, Darren, is the most important thing. Is I think the messaging sometimes has to be from the community for the community, and I think some of the work that we've done with him is starting to look at having a Latino night, for instance, because we know that that's a group that comes here, doesn't have healthcare sometimes, doesn't speak English, is missing out on how we offer PrEP properly. So, I think we might need to have, community-based interventions where we reach out to potential communities and say, how can we offer a service to you that will help? So, I think we really have to bring in our community partners more from a clinical side of it, from a programming side of it, and say, help us reach people that you think we're not targeting.
Just to add on to that, I would say that as somebody that works with youth, fellow youth, directly, face-to-face, one-on-one, I would say that there's a lot of power in having destigmatizing conversations when it comes to our sexual health in general, and having these conversations really allows us to advocate for our health even more so, and also lift up our friends that are trying to navigate those systems as well that might be confusing for them. So if we have a foot in the door, then it's our responsibility as a community to get that person behind us in the door as well.
Amazing, amazing. So we did get another question in the chat here. So this one is for Adrian/Darren. There are 1,600 public schools in BC. Many have asked the Ministry of Education to ensure that the current accurate and queer inclusive sexual health information is available in all schools, and that training is available for all teachers and other staff. Too often folks are relying on what they themselves learned in high school, which is likely incomplete. What is the best way to bridge this gap in knowledge?
Yeah, I'll start, and then Adrian, you can chime in if you don't mind. So first of all, I think many of us believe that sex education is a right, and so the main thing that needs to happen is that people who are teaching sex ed and sex education need to be knowledgeable and inclusive in the way that they teach sex ed. And so, there are some resources out there that teachers can rely on to teach sex ed, and we need to make sure that all the teachers are doing their due diligence in teaching for sex ed, and that's being mindful that not all of your students may be straight or having straight hetero sex, and that all different types of sex and sexual identities should be accounted for in your sexual education that you're providing.
Totally. I would like to add on to that and basically say that I think it's really important to create space for queer youth to come together, either in after-school programming or generally, like for empowerment, we actually have community partnership outreaches where we do like little table visits to queer youth dances, and I think those are like the most powerful moments of like seeing like the youth just be able to be themselves, and I think that's just a really powerful thing to do. So I think just creating those spaces, I think is really important, just to destigmatize, like I said, those conversations about self-advocating for our health.
I couldn't agree more. I actually did a youth dance this year, and it was one of the most like monumental things that I've ever. Yeah, I got to perform and speak at it, and it was 12 to 17, and just these kids getting that opportunity and that's in such a safe space was such a memorable and like beautiful experience for me. So like education on top. That is so. We did actually get a little bit of a request. If someone or all of you could expand on home testing and injectables and what that sort of rollout is going to look like.
I can touch on some of the injectable stuff, and then maybe Darren, I know you're doing a program and you guys have perhaps more you can say about home testing. I think one of the things that is coming down the pipeline in Canada, and we'll have to see where it falls into our options for BC, is some of the new injectable HIV medications, both for treatment and potentially as well as a PrEP option. So this is for people that perhaps are struggling with pills, having difficulty either remembering to take them or having side effects perhaps or something like that. Now we have some long-lasting medications that can be injected once every month or once every 2 months. And these are going to perhaps really offer opportunities to engage people that have really, really struggled in the past. So it's looking tremendously exciting. And there's actually very good data now coming along to show that some of these injectable agents may have a role to play for PrEP. So again, as an option for people where taking pills on a daily basis really is something that would be very challenging or something that they may want to not have at home, there may eventually be injectable options for us. And I think this might expand our ability to provide PrEP and recognize it might fit in with other people's lives and give them a bit more freedom not to have to be on a pill or have a pill bottle at home, perhaps. So it's really tremendously exciting, I think.
Yeah, and so for home testing, that's also very, very exciting because we know that for some folks in more rural and remote communities, they have to travel a long ways to get any type of STI or HIV test. And so home testing would open like a realm of possibilities up for those guys, in addition to guys who may not be connected to family doctor or guys who are not out about their sexuality in healthcare settings. Home testing really adds accessibility to a large number of folks that we know would like to access HIV testing.
Fabulous. We do have another question for Mark. Can you tell us more about STI PrEP and if we might see it available soon?
STI PrEP, well, somebody is definitely at the cutting edge of science. So STI PrEP is definitely a new idea and somewhat controversial, perhaps. The goal really is to acknowledge that our rates of gonorrhea and chlamydia and even syphilis have just continued to climb steadily over the last few years. And we have to ask ourselves, are there other interventions that can reduce people's risk of infection the same as we can do for HIV? And we have data from a very big study in France that looked at taking a very common antibiotic, which is called doxycycline, and it showed that if you took it as PEP, so post-exposure prophylaxis, you had sex and then took the medication, it had a very big reduction in the risk for chlamydia and syphilis infections. People have argued to say, well, we don't know what the long-term effect in terms of maybe resistance or other things would be from taking antibiotics that way. So there's probably a lot more steps of evaluation that we're going to go for before it becomes a routine thing. But as you know, we've done a study in the city with Dr. Troy Grennan at the BC CDC looking at tolerability and acceptability of using this type of strategy for preventing chlamydia and syphilis. And the first pilot part of it, just looking to see how people did with the medications, was very well tolerated. We saw hardly any infections in people using that as a strategy. So my personal hope is, as we gather more scientific data, this might become one of the more routine things that will be integrated as an option for people that have struggled with infections in the past. The other thing that's being evaluated, and I think will be very exciting to see where it goes, is there is some evidence that a vaccination which is designed to protect people against meningitis might actually offer some coverage for gonorrhea infections as well. And that's being studied now in a very large study to see if that will hold up. So I think the next few years hopefully will bring a lot of options for STI PEP or PrEP. And I think this is definitely something that we want to be at the forefront of, given what we've done with HIV, just added to our repertoire of prevention services for people. So I think that's, let's keep checking in on that topic.
Absolutely. So what can guys be doing now to improve their sexual health during these trying and kind of wacky times? Any advice for hooking up during COVID times?
Well, I think it's very important to, keep following the COVID-19 guidelines. BC CDC has put some out, and, on social media, we're maybe all like seeing glory holes trending, and some people might think that it's a joke. Or that it's like not real, but actually that is one way to prevent transmission of fluid. A wall in front of your face prevents kissing, and so I think it's very important to keep that in the forefront of your mind. All of the steps that you can take to have safer sex in this time, but also I want to add that like with all of the guidelines and restrictions that we're all reading about, it's very important also to consider the type of messaging we're giving to guys who are having casual sex at this time, and to remember that we always should be in the realm of sex positivity, and stigma is one of the biggest barriers that people face when accessing sexual health care. And so if we can eliminate stigmatizing language or shaming language when we give advice to our friends and family around sex, that will actually add a lot to the safe ways that we're having sex also.
Totally. Be proud of your glory hole usage.
I just want to add one other message I think that's very important is we definitely have had a lot of people stop their PrEP because they've said, oh, I'm not going to have sex, I'm going to be at home, I'm avoiding COVID. But let's be honest, like sex happens and sometimes you don't really plan it. And I think there are two important things I would like to say. One, the clinics like him are still operating. If you get symptoms of something, come in. We need to treat you. But more importantly, our NPEP program still continues to offer PEP. So if you had an exposure where you weren't on PrEP, don't feel shy. You need to come in and get NPEP. We don't want people to forget about post-exposure prophylaxis because it's a backup option if you had sex and you weren't using condoms and you weren't on PrEP. So we'll make sure people think about NPEP.
Yeah, I think, just basically just to communicate your comfort levels, I think is always like I said before about basically just communicating if there was any symptoms that were coming up that you were experiencing as well on the other side of that, of just making sure that you're just being as communicative as possible. I think that's just the biggest thing to do. And basically just do it with respect and like Darren was saying, try not to do this whole shaming thing if your friends do come to you with advice, and just make space just to hear them and just always just like follow what Dr. Bonry Henry is saying basically. Thank you.
Alrighty, guys. Thank you all so much for all of your answers. I'm feeling full of knowledge. That is all the time that we have for now. Once again, I would like to thank the three sexpert panelists, Darren Ho, Dr. Mark Hull, and Adrian Bustamante, for sharing their insights with us today. These folks all live and work in our community, and their organizations are working to improve the health of queer and trans British Columbians. We can never have enough discussions about our community's health, especially during Pride season. Huge shout out to ViiV Healthcare for sponsoring this event. If you like this presentation, make sure to follow Community-Based Research Center at BC GbMSM and YouthCO at YouthCO for more content. And if you liked me, you can follow me at Kendall Gender on every social media platform that your little heart can imagine. to leave you with this amazing, amazing words from the fierce Dr. Bonnie Henry. Be kind, be calm, and be safe. Happy Pride, everyone.